Another toxin is in the news affecting your thyroid and your metabolism. Do you have unexplained weight gain? Are you tired all the time? Is your hair falling out? Are your eyebrows thinning? These are all signs. And so many people are suffering from hypothyroidism. And here is one more cause. Exposure to something called organophosphate ester, OPE metabolites, is a newer group of widely used chemical flame retardants. It is linked to a higher risk for thyroid disease. So they included almost 2,400 participants, about 46 years old. And what they found is that more of them that were exposed to these OPEs had higher risk of thyroid disease. The three models in their study provided similar results, with exposure to mixed OPEs having a tendency to increase the risk of thyroid disease. And so what is going on? We are talking about dioxins and fluoride and mercury and all of these things that are affecting our thyroids. And when our thyroids aren't working, our hormones are off, our libido's down, our hair is thinning, our skin is dry and icky, and we're retaining water, so many things. So what is going on? In the last 4 years, the number of people suffering from hypothyroidism has increased significantly. The thyroid is the master endocrine gland. If it's not functioning properly, everything suffers, your liver, everything. The immune system is suppressed and chronic disease will surface. So it's imperative to take care of your thyroid. So what are the signs to look for? Like I mentioned, hair loss, eyebrows thinning, irregular menstrual cycles, anxiety and depression. It is the number one cause of depression is low iodine and low thyroid. Weight gain, constipation, headaches, brittle nails, fluid retention, you're cold all the time, you have a puffy face, swollen eyelids, poor circulation, poor concentration, and like I mentioned, decreased libido because your thyroid affects your adrenals and your sex hormones as well. So what are the causes? Number one cause of hypothyroidism is iodine deficiency. And we're going to take this back to how it relates to the chemicals. Iodine is crucial for the thyroid hormones T3, T4, T2, all the T's, tyrosine, and 3,4,2 molecules of iodine. You cannot have thyroid hormones without iodine. Dr. David Brownstein has come out and he has increased his dosage recommendations because of the toxins like the ones we're talking about today, because iodine helps with detoxing the body and helping with the thyroid. 96% of the United States is iodine deficient. So our needs for iodine are going up and our iodine in our soils is going down. It's non-existent. And iodized salt is full of microplastics and the wrong kind of iodine that your body can't even use. So that iodine deficiency is the number one cause of hypothyroidism. And then you have the iodine disruptors. So environmental toxins like we're talking about right now, it can interfere with the uptake and utilization of iodine by the thyroid. The most obvious, fluoride, bromide, chlorine, but these OPEs as well. So where does iodine come in here? Well, we want to go back to chemistry class and talk about halogen displacement. The halogens were in the column, right? You've got iodine and fluorine, bromine, chlorine. Iodine is the heaviest and because it's lower, right? So displacement is a scientific principle in chemistry when the elements from the same group in the column of the periodic table that have a lower atomic weight, like the fluorine, bromine, and chlorine, naturally displace elements in the same group, like the iodine. So we're not just talking about these, we're also talking about like the toxins, like we're talking about with the OPEs. So the reason is that each element of that group has the outer shell has the same number of electrons. This identical outer shell allows different elements of the same group to take over the same receptor sites because of the same number of electrons, and that is the key to allowing them in. This is why fluorine, chlorine, and bromine will naturally displace that precious iodine. So this is why we need to increase our dosages of iodine to make sure all 100 trillion cells are filled with that iodine, displacing these toxins, including the OPEs that we're talking about. And the opposite theory is that competitive inhibition, where if you've got, it's the opposing scientific principle to displacement. It is defined as when the elements from the same group that have a higher atomic weight, like iodine, can forcefully displace these elements in the same group with the lower atomic weight with a high dosing of that element. And that is why Dr. Brownstein and I are both coming out with higher dosages needed of that iodine. And you don't want just any iodine. You want the acceleradine iodine because it is monoatomic. And what it also has, it has a negative charge. What does that mean? It pulls the positively charged toxins out of the body. As I said, 96% of the United States is iodine deficient without that proper iodine supplementation. And the thyroid gland will fail to function properly without that iodine. The acceleradine iodine is the only one with a single atom of iodine easily absorbed with 100% absorption to help provide the sufficient iodine for proper metabolism and fat burning. It helps detox all the cells of the heavy metals, the toxins, the radiation, everything we've talked about, including the fluoride, the chlorine, the bromide from the cells that lead to hypothyroidism and the other chronic diseases. If your thyroid is suffering, we're not just talking about unexplained weight gain and not looking good. We're talking about your immune system being suppressed, not having the energy to fight off infection. It is lowering that ATP in the mitochondria. Your mitochondrial health is your health. And acceleradine iodine increases ATP by 18 times. And it also is going to help alleviate the damage done by the spike protein, which has been connected to cause worsening hypothyroid symptoms. It also helps clean the blood so that the liver can do its job and further detox the body from the toxins related to hypothyroidism. You use with it the accelerated ancient salt to plump up the volume of the blood to get the toxins out. So the acceleradine and the accelerated ancient salt work together to detox the body, rehydrate the body, and give your cells that energy. You need that sodium and potassium from the accelerated salt to plump up the cells and support the sodium potassium pump on every single cell. Now, combining the acceleradine iodine with the accelerated thyroid is going to support your thyroid health and reverse the symptoms of hypothyroidism. It's the most comprehensive natural thyroid supplement to help restore thyroid function. It has the grass-fed thyroid glandular to provide the peptides, the amino acids, the needed nutrients for the thyroid. And then we add in the ancient herbal Ayurvedic formula called Kanchanara, known to detox and support the thyroid, in addition to adding in amino acids that are needed for thyroid optimization. We then enhance it with scalar frequencies to help clear the emotional and physical shock from the body, improve overall health of the thyroid, so it's alleviating any of the symptoms and restoring your thyroid to its normal function. It is also enhanced with frequencies to further detox the halogens, the heavy metals, the radiation, and the OPEs like we're talking about today. And lastly, it is enhanced with the frequency to balance the thyroid and the parathyroid health together. They're like a teeter-totter. They go together, right? So the accelerated thyroid helps prevent fatty liver, which fatty liver is the #1 fastest growing disease in the United States. It helps with wound healing, strengthening your connective tissues and bones, helping with mood, and strengthening digestion. Of course, you want to focus on whole foods. You guys, everyone's talking about keto, paleo, vegan, carnivore. It's not necessarily about low carb, high carb diets. It's about real food, and it's about getting rid of the oxalates, the sulfur, the amyloid proteins, and the wrong fats. So I go into all of that in my coaching and with my accelerated food guide. You can check that out. It is so important to be taking care of the food that you're putting in your body as we're trying to get these toxins out. These toxins like the OPEs that we're talking about today, they're in our environment. We're going to be exposed. You're not hiding under a rock. What we have to do is detox our body on a daily basis with the accelerated iodine, with the accelerated thyroid, and the accelerated salt, and then put into our body whole foods, the wild animal protein, the vegetables that don't have the oxalates and the sulfur, and the right kind of fat. Stay away from the processed foods. So there's just a little tidbit of what I do in my coaching. So make sure you join. There's no downside. And thanks for tuning in today. If you need my specific help for you, feel free to reach out to me through SaraBantaHealth.com. I'm here to help you. Join my free group coaching on Telegram. No downside. I share daily tips and tools to improve your health, and you'll be surrounded by an amazing group who are on the same path as you are. You'll gain valuable support, and I am there 7 days a week to answer your questions. Follow me on social media at Accelerated Health Products, and you can catch this podcast on over 100 platforms, including Spotify, iTunes, iHeartRadio. Just search for Accelerated Health TV and radio show. I'm on a mission to share my healing message with you and the world, so please help me with that goal and share this with a few of your friends. Thanks again for joining us here, and have a great week.